Hello, my name is Moira'a Wilson, and this is my head-to-toe assessment with a focus on respiratory and neurological. So to start the head-to-toe assessment, you're going to inspect the face for symmetry, and you're going to palpate the scalp, noting size, contour, any kind of deformities. Next, you're going to palpate the frontal and maxillary sinuses, noting any kind of tenderness. Then inspect the eyelids, eyebrows, and irises for symmetry. And then you're going to inspect the pupils. So we're going to keep Pearl in mind, which stands for pupils are equal, round, and reacted to light. So to test that, which is cranial nerve number 2, the reaction to light, we're going to take our pen light here, move from the outside in, that, and move from the outside in, like so. And then we're going to do the follow the finger test. So ask the patient to keep their head straight and just follow the finger to the 6 different points using their eyes only. And this tests cranial nerve 3, 4, and 6. It says convergence. You bring your finger close, then bring it back far. Okay. And next, we're going to test the patient's hearing. So we're going to take our tuning fork here, and we're going to start with the Rhines test. So we hit the tuning fork, bring it around the patient's ear, tuning fork, bring it around the patient's ear again. This is the Weber test, putting the tuning fork on top of the patient's head and noting any kind of hearing loss, if the sound seems stronger in any part. You can also do this with the whisper test. That's all testing cranial nerve number 8. We're gonna palpate the lymph nodes in the neck. So tonsillar here, submandibular, submental, anterior cervical, posterior cervical, and subclavicular. And lymph nodes are a indication, if they are palpable, of an infection in that area. And then you would test the patient's thyroid. Next, we're going to assess the lungs. So we're going to start posteriorly, inspecting for equal expansion, symmetry, and we're going to palpate both for equal expansion, and we're going to palpate for tactile fremitus. So we're going to have the patient repeatedly say 99 as we feel the vibrations down the back. And now we're going to auscultate breath sounds, noting any kind of adventitious breath sounds. So we're going to go bilaterally down the back, and we are listening for any kind of wheezing, which is like a high pitch noise that is common with asthma, crackles, which indicates fluid in the lungs, rhonchi, which is like a snoring noise, which could indicate consolidation, or a stridor, which is another high-pitched wheezing noise, which could indicate a blockage in the larynx or the trachea. Next, we're going to have the patient move anteriorly, and again, inspect for equal expansion, palpate for equal expansion, tactile fremitus, and doing the same thing. We're going to listen for adventitious lung sounds anteriorly now. Then we're going to auscultate heart sounds, starting at the aortic. And we are listening for rate and rhythm. Pulmonic. We have the Erb's point. Tricuspid. And we have the mitral or apical. We're also going to assess the pulses. So you have your carotid pulse here, brachial, radial, femoral right in here. You have your popliteal behind the knee. You have your posterior tibialis, or posterior tibial, which is right over here. And you have your dorsalis pedis, which is right on the top of the foot there. So for the neurological assessment, I talked about some of the cranial nerves already. I'm going to talk about a few more now. CN1 is the smell, so you would have a patient smell, familiar smell, maybe like coffee beans with their eyes closed, and describe what they smell. Cranial nerve number 5 is your jaw here, so you would clench the teeth, open the mouth, and kind of feel here, the sides of the jaw. Cranial nerve number 7 is the facial nerve, so you raise the eyebrows, ask the patient to move their facial muscles. Cranial nerve number 9 and 10 is testing the patient's ability to swallow, so you'd ask them to swallow. Cranial nerve number 11 is shrugging the shoulders, turning the head side to side. And cranial nerve number 12 is sticking the tongue out and moving it side to side. Okay, then we test for deep tenon reflexes. So we'd use our tool here, and we would test the brachioradial, brachial, the tricep back here, take the other ends, the lateral ends, test the knee, the patellar. We would test the Achilles back here in the back of the foot, and then we would do the plantar. So we would take this end and we would start the heel and move it up and test the reflex that way. And then we would rate each reflex on a 0 to 4 scale, with 2 being normal, 0 being nothing, and 4 being hyperactive reflexes. And then we would finish with doing a coordination and balance test. So we would do the Romberg test. So we'd have a patient close their eyes, stand 20 to 30 seconds, note any kind of swaying, and ask them to put their arms out, still with their eyes closed, 20 to 30 seconds, and noting any kind of lack of coordination. And that is the head to toe assessment with a focus on respiratory and neurological.